Fantastic. Okay, well, welcome everyone to today's session. This is the second in a series of webinars on the use of cannabis, and we're going to cover the effects of cannabis. Today, it's Twinkle, Ruparel, and Kate Hodgson who are going to be going through quite a few different things. My name is Gemma Greenwood, and I am your host for today's session. Before we begin, I am going to invite Paula to get us started. So Paula, if you can go ahead and unmute yourself.
Hi, good afternoon, everyone. Thank you, Gemma. I'd like to take this opportunity to welcome everyone and to acknowledge that the First Nations Health Authority staff here that's doing the presentation is on the unceded territory of the Coast Salish people, and that includes Squamish, Musqueam, and Tsleil-Waututh. So thank you and welcome.
Thank you so much, Paula. That's fantastic. And yes, as I already introduced myself, my name is Gemma Greenwood, and I am the curriculum learning consultant here at First Nations and working with the Four Directions team. I am going to pass it over to our other two presenters today. So Twinkle, go ahead. Oh, and before I forget, oh my goodness, I am zooming in today from the unceded territory of Squamish Nation, where it is a beautiful and cloudy and rainy day. Over to you, Twinkle.
Thanks, Gemma. Hi, everybody. Welcome. My name is Twinkle Ruparel, and I am a FNHA pharmacist with the Four Directions team supporting mental health, substance use, harm reduction, and reconciliation. And today I'm calling in from the traditional and unceded territory of the Coast Salish peoples. Thank you.
And Kate.
Hi, everyone. My name is Kate Hodgson. I'm a practice consultant for substance use with the Four Directions team, and I'm humbly calling in from the unceded and traditional territory of the Ta'amin Nation people.
Fantastic. Thank you so much. And thank you, Paula, for getting us started. So now I would actually like to pass it over to everyone that is on the call. Please take a moment to introduce yourself in your own way and share with us, where are you zooming in from? So go ahead and use that chat. If you haven't seen it already, if you hover over the bottom of your screen, you should see a little chat icon, and that will open up the chat on the right-hand side of the screen. So go ahead and add in, where are you zooming in from today? So what are we going to actually be covering in today's session? Well, we're going to be taking a look at cannabis from a medical legal perspective. We'll also review the endocannabinoid system, how the effects of cannabis, how they interact with our body, and what adverse effects we have. We're also going to take a look at some clinical considerations, screening for cannabis, when is cannabis use problematic, a case study on chronic pain and cannabis, the one that I mentioned that will happen towards the end of the session. And then finally, we are going to have a little game for you right at the very end. So if you were hoping to multitask, then don't, because some of the questions that are going to be shared throughout, some of the content that is shared in throughout today's session will be asked in the form of questions. For those of you, for the person who gets the most points, will win a gift card to the value of $25. So I encourage you to stay right until the very end. To get us going, I am going to open up a poll. So let me bring this up. So go ahead and select all the options that you see on there that are stigmatizing, especially when working with people who use cannabis. Fabulous. Thank you so much. So take a look. The number one option is that stoner and pothead. To be fair, actually, all of the options that you see on your screen are actually words or labels that stigmatize cannabis use. And it can place blame on the individual who is using cannabis. So despite the legalization and increasing prevalence and acceptance among the general public, cannabis use continues to be viewed as dodgy, as I like to say, or dishonest activity in many contexts. If somebody feels stigmatized, they may not want to seek treatment, and this can negatively influence healthcare providers' perceptions with people who may have cannabis use disorder, and it may impact the care that they provide. So just something to keep in mind. Okay.
Okay. I think, can I close this poll on here? Okay. Okay, and this slide is also to bring forward some of the learning we did in the previous seminar. So use the annotate function or the text function, and please write in here things we can do to end stigma towards cannabis use. You can also type in the chat as well.
So remember to get the toolbar. You can, there we go. We've got a few coming up, but yeah, remember to click on view option and then text.
Absolutely, thank you. Yeah, using kind language or use of just language, cannabis education, so educating yourself and educating others in an open way. Talking about it is great. Yes, awareness, stopping and to truly listen. Exactly. Yeah, and targeted awareness as well is really important. Thanks.
Fantastic. And I see on the chat, like, discuss it more often in professional and casual conversations. Absolutely, Tamara. Okay, so 1 second as I clear this. All right, over to you, Twinkle.
Okay, great audience we have today. So what are some other names used for cannabis by people you interact with or by individuals you provide care for? So go ahead and use the annotate function or type in the chat. Yes, weed, pot, marijuana. Iho, okay, that's very new to me. I have not heard that before, but interesting. Kush, Mary Jane, dabs, weed, pot, MJ. In the chat, we have ganja, mall, dope, shatter, doobie, mellow yellow, okay, grass. These are some new ones that I didn't know about. Butter, okay. Spliff. Yeah, so all of these words loosely, very, very loosely define cannabis, and it's very broadly, these are the street and slang terms that you hear. Okay, so cannabis or marijuana is a broad term that refers to the dried and harvested flowers of a group of 3 plants, Cannabis sativa, indica, and ruderalis. It includes 400 plus different compounds, including 140 plus different cannabinoids. So most common marketed preparations include THC and CBD in various strain, dosing ratios, or dosage forms. THC, as we know, is a psychoactive component. It is demonstrated to have pain modulation, but also potential for dependence due to its euphoria-inducing properties. And CBD is a non-intoxicating component, which is being studied for its anti-inflammatory properties. So there are varying medical and ethical perspectives on whether cannabis is useful or harmful. So noted here are some arguments on both ends of the spectrum. It may be useful if a patient has tried other medications with no benefit from a harm reduction perspective, or if there is a good response to cannabis, for example, decreasing the use of opioids. On the other end, there are concerns around the unknowns. So the number of compounds being consumed, medication that is being smoked, quality and type of evidence, ethics, and considerations as to whether this is mirroring the opioid crisis, given that opioids were a low barrier prescribed medication at one time. So because of these considerations, it's important to review scientific evidence and its challenges. Currently, there is a limited number of randomized controlled trials, and they have several limitations. Because of the quality of this research, there is low confidence in assessing harms or benefits of cannabis. This leads to a conclusion that high quality research is still required. As of 2019, there are approximately 60 cannabis research studies currently underway across Canada. More than half are taking place in Ontario. And the outcomes of these studies and those across the globe will hopefully inform the future therapeutic framework of cannabis. So medical cannabis has been legal in Canada since 2001. In 2018, Canada became the second country in the world after Uruguay to legalize possession and use of recreational cannabis. The Cannabis Act provides the regulatory framework for appropriate consumption and use of recreational product. It is designed to better protect the health and safety of Canadians, to keep it out of the hands of youth, and to displace the illegal market by keeping profits out of the hands of criminals and organized crime. The idea was to create a regulated supply chain, access to quality controlled cannabis, create jobs, and in turn, a stronger economy. So currently, dried cannabis and oils are legal for recreational and medical use, and some edibles and topical products are also legal. Canada has a two-stream system for cannabis, which is medical and retail sale. So this chart shows the two parallel streams. For the medical use stream, there is a specific eligibility criteria and framework in place to acquire it for that purpose. And the retail stream branches into licensed stores or online platforms. Both medical and retail streams often share a same source of purchase and provide a quality controlled product. However, we continue to see unregulated dispensaries and online suppliers. And this unregulated market further increases health risks due to the lack of quality and oversight on cannabis production. So besides quality, there are other factors that affect choosing between medical or retail cannabis. For example, access. So medical cannabis is only accessed by mail or courier, while retail is widely available. There are stringent paperwork requirements for medical product and none for retail. Coverage and cost can be some factors. For example, private insurance companies may cover medical use cannabis on a case-by-case basis. Veterans Affairs covers limited amounts as well. And medical cannabis is often accessed at a lower cost compared to retail. Lastly, dosing and guidance is challenging because there isn't a usual studied dose or interval. For medical use, a prescriber may pick a strain or ratio and maximum quantity allowed. Overall, there is a lower production standard with cannabis compared to prescription products. So from the medical perspective, it is important to note that there is no official Health Canada indication for medical use of cannabis in Canada. However, off-label use means that it may be medically authorized by an approved practitioner for any indication. So noted here are some disease conditions where cannabis is usually prescribed off-label based on the current evidence or demonstrated benefit. It may also be used as an adjunct to reduce the use of other medications. So many prescribers will not prescribe something that can be smoked due to health and dosing concerns. Here are prescription products that are currently on the Canadian market: Nabilone and Sativex. These are generally not considered first or second line for any indication, and their use is reserved in patients who have failed other therapies. So Nabilone is a synthetic THC medication, and it's indicated officially for chemotherapy-related nausea and vomiting, and has other off-label uses. Sativex is a sublingual spray combination of THC and CBD. It's indicated for advanced cancer pain and MS-related spasticity or neuropathic pain.
All right, so we have another poll coming up for you guys. So other reasons why patients may prefer prescription products over when cannabis is legal. And 1 second. So go ahead and select all that apply. All right, there are the results, Twinkle.
Great, thank you, Gemma. So yes, all of these factors from one degree to another could affect choice between choosing prescription products over the legal cannabis. So quality, because prescription products are pharmaceutical grade product, they have standardized dosing, official indications for use, which also increases prescriber confidence in prescribing it, access from a community pharmacy, and in turn, increased engagement with the healthcare system, and also for tax and coverage purposes as well, as some third-party insurance companies may cover prescription products more readily.
Fantastic. All right. And another poll for everybody. So let me bring that one up. How would you identify an authorized cannabis product? Now you can only select one, so let's see. What do you guys think? So, oh, look at that. We have packaging, excise stamp, and appearance. So, and I'm going to move, I don't know if you can move the poll on your side at the same time as I can, or if it's moving just on my screen. But what we were looking for here is really the excise stamp, although I guess the excise stamp is on the packaging, so maybe we'll give that as well. But these excise stamps that you see on the screen are forgery, can't say that word, forgery-proof stickers with visible and overt security features that are found on legally distributed cannabis products. Each province and territory has a different stamp, and BC has that teal turquoise color that the green arrow is pointing towards. So Twinkle, bear with me 1 second. I'm just going to remove these little hearts that keep showing up, which are great, but we're going to be using them in a second again. So over to you.
Thank you, Gemma. So when cannabis is consumed, it interacts with the endocannabinoid system, or ECS, to produce a response. So what is the ECS? It is a complex neuronal modulation system in the human body that regulates various physiological functions, as noted here. The primary purpose is to restore homeostasis or balance after a function is performed. It has been researched quite extensively, and it consists of 3 components: cannabinoid receptors, which I will use the analogy of locks, endocannabinoids, which are similar to keys that would activate these locks, and enzymes. So receptors, your locks, have 2 subtypes, CB1 and CB2. CB1 receptors are found abundantly in the central nervous system and in low concentrations in the peripheral nervous system. So when THC in cannabis binds to CB1, a psychoactive response is produced. CB2 receptors are predominantly found in the peripheral nervous system, especially immune cells. They have some role in pain modulation, inflammation, and immune response to pathogens, and possible expression in the brain is also being researched. And endocannabinoids, which are keys, and these are cannabis-like substances that are actually made by the human body and produce a response by activating the receptors. 2 endocannabinoids have been extensively researched called AEA and 2AG. And depending on the location of release and the type of receptor, they will have effects on neurotransmitters or metabolism or immune function. And enzymes are substances that activate and break down the endocannabinoids once the response is exerted.
Fantastic. Wow. So now that we know a little bit more about the endocannabinoid system, when you do consume cannabis, it does produce a multi-system response depending on the method and route of ingestion, the concentration of THC and CBD, and the receptor location. So on the screen, you see all these different types of effects. So what we would like you to do is to go ahead and select your stamp. So remember, you want to click on the top of your screen and click on View Options, and then select Annotate to bring up your bar and go onto the stamp. I know that some of you have been using it, so find your heart or your star, and we want you to place on all of the effects that you see on the screen. We want you to place your stamp and let us know which one would you like us to discuss a little bit more. Thank you, Paula. You started us off with pain relief. So go ahead and just fill in all the different ones. Place your stamp, either your star or your little heart or your check mark. There we go. Now you see more people. And those who have the options, the effects where we get the most, then Twinkle's gonna give us a bit more of an explanation. If you don't have this, then feel free to use the chat if there is anywhere that you would like to, is any of these effects that you'd like to learn a little bit more about.
Okay, I see a lot of answers. Or questions, shall I say. Yeah. I can start from the top on the left side. So increased dopamine release. Cannabis triggers the release of dopamine in the brain, producing psychoactive effects, which we know as feeling high. And dopamine can also heighten sensory perception. Increased or decreased anxiety. So impact of cannabis on anxiety differs from person to person. High doses or concentration have been noted to produce panic, though. Glaucoma relief. Cannabis can temporarily lower pressure in the eyes, which in turn relieves symptoms of glaucoma very temporarily. Accelerated heartbeat. So there's an immediate increase in heartbeat that can last for hours once it's consumed. The munchies. Yes, cannabis stimulates appetite, which may be useful for patients undergoing chemotherapy or low appetite related to AIDS, HIV as well. Reduced nausea and vomiting. Cannabis may relieve nausea and vomiting associated with chemotherapy, absolutely. Pain relief, yes. So one of the primary reasons why cannabis is consumed, it's for pain relief. It may help relieve pain and inflammation in the body. Withdrawal symptoms, so small possibility of dependence on cannabis after long-term use. And so sudden stopping can result in withdrawal symptoms as well. Increased or decreased, so many stamps. Depression symptoms, okay. So cannabis may ease certain symptoms or depression, but withdrawals may advance the feelings of depression as well. So it's kind of that paradoxical effect. Trouble for the developing brain. And yes, this is absolutely something we know. Cannabis in youth or in pregnancy affects normal brain development, as normal development continues till the age of 25. Burning mouth. Smoking can lead to possible burning of mouth and throat. Lung cancer risk. This is being studied at this time. Immune system, immune function may be affected. The linkage is again being researched. And I'll cover one more, risk of tumor growth. So yes, this is also being studied. Anecdotal evidence suggests that cannabis interferes with tumor growth. However, there isn't a clear connection at this time.
Great. Thank you. And Twinkle, we did have one question just because it's in relation to this slide from Rose on the chat. And I unfortunately, I'm not sure what she's asking, what about photopsia, if that's how you pronounce it? Will it calm them? I'm not sure.
That's a great question, Rose, and I will need to look into that as well. I'm not quite familiar with that effect readily being studied. If you could kindly share your email, I can get back to you. Awesome. Thanks, Shema. Okay, so noted here are some short and long-term adverse effects associated with cannabis use. Short-term effects have varying onset, so from 5 minutes to 2 hours, and are generally reversible as the body eliminates cannabis, whereas long-term effects are manifested by prolonged heavy use or consuming high-potency products. It's also important to note that over the years, we've seen an increase in the concentration of THC in cannabis products. So short-term effects such as motor coordination, altered judgment, difficulty thinking or focusing gradually dissipate over time. However, high doses can cause paranoia, hallucinations, delusions, or psychosis. And then long-term effects include a high risk of dependence, new onset or worsening mental health conditions, and as we discussed, impaired brain development, especially noted in adolescents and youth.
All right. Oh, 1 second. My mouse is doing this thing where it likes to disappear on me sometimes. Wow. Oh my goodness. Thank you so much, Twinkle. That is so much information and really useful information. Learning a lot more about cannabis and the effects that it has on the body, about the endocannabinoid system. And now, before moving on to our next section, learning more about how, now that you have all of this knowledge, how can that influence your relationship with your clients? Wanted to ask you this question. How often do you screen for cannabis use with your clients, if applicable to you? So go ahead and give us an indication. All right. Well, would you look at that, Kate?
Great. Thanks, everyone. Thanks, Gemma. Thanks for participating. So I'm assuming the not applicable roles are administrative or educator roles or roles that don't have direct client care. But it's great to see that sometimes we are screening for cannabis use. We'll get more into that. Okay, so thank you, Twinkle, for setting the stage and providing some information on the adverse effects of cannabis use. For the remaining part of the discussion, we're going to be looking at some clinical considerations of cannabis use and how it fits into practice. So in the spirit of learning and using this space as a safe place to inquire and explore what we already know about cannabis use, I'm going to ask you some questions that are going to come up on the screen, and I invite you to type in the chat or use the mic, whatever speaks to you, and answer some of these questions, and then we'll speak to each of them. So the first question is, why is it important to screen for cannabis use? You can type in the chat or use the mic. Yeah, for workplace reasons, medication interactions, Thanks, Corinne. Exactly. So screening for any substance use is a wellness approach aimed at identifying and reducing the risks of preventable disease and injury. It's not about making assumptions about a person's lifestyle or a person's personal choices. It's about offering information so a person can make informed choices for themselves about their own substance use. So reasons why we screen for cannabis use is because cannabis, we know, is so widely used. It's the most widely used substance after tobacco and alcohol. So it is important to screen the general population as we would for tobacco or alcohol because we know it is so widely used. And legalization, as Twinkle just spoke to, has created opportunities for people to consume cannabis who may not have before. So it's important to just be flagging some of those risk factors. Okay, the next question. In which clinical setting should nurses or other healthcare providers be screening for cannabis use? You can type in the chat or use the mic. Thank you for your participation. Yes, all clinical settings. So it's correct. Yeah, all of you are right. It is all clinical settings. We especially want to be screening in places like primary care, because we know that the general population is using cannabis. We just want to be able to provide that education. And emergency department visits for sure, just to rule out any important differential diagnoses. And areas like mental health, chronic pain, youth clinics, and prenatal care are really important because folks who visit these places may be at greater risk of the adverse effects from cannabis. So we just want to be able to have that education and conversation. So the next question is, what type of screening tools are used in your clinical setting? So this is more exploratory about what folks are using out there, if any at all. Exactly, thanks Vanessa, yeah. So from my clinical experience is that cannabis-specific validated tools are not as widely used as how we would screen for alcohol, like with the cage tool. However, tools do exist. There's the QDIT-R, which is the Cannabis Use Disorder Identification Test Revised. And then we also use a very common one called SBIRT, which is for any substance, but it's screening, brief intervention, and referral to treatment protocol. So thanks to Vanessa, screening does not have to mean using a standardized tool whatsoever. It can just mean having an open conversation to start or just asking about cannabis. So a great question to start with is, do you use cannabis? If so, tell me more about that. And a thing to keep in mind is that if you are going to screen, it's best to start with non-intrusive questions that commonly address other risk factors. For example, like, do you get a flu shot? So this is just a great way to get the client on the same page that you're addressing this from more of a public health perspective, and that helps build rapport and trust with the client. So the goal of screening is, again, to help healthcare providers identify a person's risk associated with the substance use and to identify those who may be at risk of moderate to severe cannabis use and be at risk of problematic cannabis use, and just to have a more in-depth conversation or in-depth assessment about that. So the last question is, do you see any problems with these tools? So as we know, there's limitations to everything. So you can use the chat or the mic.
I would say the biggest thing that I have noticed is the duty to report, which really freaks a lot of Indigenous patients out. And I know that the birth alert system that they say isn't in place, but is no longer in place, but is actually still being used, is one reason why I think some patients wouldn't be truthful in that screening. Especially for like Indigenous women who have seen the MCFD knock on their door in the past. So,
thank you for that. That is a really important point. Yeah, and as we know, like the birth alerts have been banned. However, that doesn't take away the existing stigma and the history of that, and maybe perhaps even practice that still occurs. So that is a really important point. Yes, screening tools, they can also have false positives. So for example, the screening tools do not capture like the quantity of cannabis used. It doesn't capture the safety of the environment someone is using in. And yeah, we really caution around a one size fits all. And I really appreciate that context of the perinatal visit and that trauma informed approach and deciding when a cannabis screening is going to be appropriate. So any screening or assessment is going to be done in conjunction with motivational interviewing to help someone think about their personal motivation to change and any discrepancies that they have about where they're at, and doing that in a trauma-informed way. Okay, so just to finish up on this slide okay, we know now when to screen and the issues of screening and what tools are available, but when is cannabis use problematic? So we're going to say again is that not all cannabis use is problematic. In fact, a very small amount of people who use cannabis actually develop cannabis use disorder. And we even use that term cannabis use disorder as a way that we just refer to the DSM-5 criteria. And it's only in a physician's scope to diagnose from the DSM-5. However, if we are seeing some maybe some red flags of a moderate to severe cannabis use, then we could be bringing in a physician or more of an expert to be using something like the DSM-5 diagnosis tool. Great, next slide. So on this slide, we're just looking at a few cannabis clinical snapshots. So these are 3 examples. Most often, these examples may happen in like an in-office setting, maybe in a home care situation, mental health situation. So they don't really address all clinical scenarios, but I'm just going to quickly go through them and speak to some important considerations or possible interventions you could consider in regards to cannabis use. So the first one is a client self-reports to you that they use cannabis and alcohol, and they're also taking benzodiazepines for anxiety. So benzodiazepines is a medication like Valium or Ativan. So in this case, you would want to clarify the difference between simultaneous polysubstance use and concurrent use. So simultaneous polysubstance use is using substances together at the same time. So that would be using alcohol and cannabis together. And concurrent substance use is using them independently. So for example, on Friday using alcohol and on Saturday using cannabis. So in this case, you would want to tease that out and then educate the client that if they're using alcohol and cannabis together, they do have additive effects and you could be more intoxicated than if you use them alone. The other piece that you would want to support the client in is just recognizing the risk in consuming benzodiazepines and alcohol together, because we do know that alcohol increases and prolongs the effect of benzodiazepine medication. Okay, so the next clinical scenario is you are in an office with a client and you know that they are in a safety sensitive occupation. So this goes back to Harold's comment about cannabis in the workplace. So safety sensitive occupation is like high voltage electrical, truck driving, those types of things. And they disclose to you that they are using cannabis daily. So things you would want to consider would be you want them to think about the potential safety risk and their work environment. So it could be an opportunity for you to ask a person if there's any workplace policy around cannabis use, and just have the person maybe look at that and think about it in regards to their cannabis use and make the best choice for them. You would also want to let them know that impairment from cannabis use can last for more than 24 hours. So the Occupational and Environmental Medical Association of Canada does recommend avoiding safety-sensitive work for 24 hours after using cannabis. And you could also help the patient be made aware that those longer-term cognitive impairments that Twinkle spoke to, it's unknown how long they last for, especially after daily or heavy cannabis use. The third clinical scenario, sorry, I'm just gonna take a water, is with a chronic pain client. So you're sitting with them and they report to you that cannabis is helping them reduce their need to take prescription opioids. So Twinkle did speak to this. And so there is limited evidence saying that cannabis reduces pain severity. However, this would really be a great opportunity for you to engage with the client around an in-depth pain assessment. So they're opening the conversation about their pain, and it would be great to know when they have the pain, how it affects their life, and maybe build a bit of a care plan around that. And they've also identified that they are using cannabis. So it's also opening, there's clearly an established trust, and you can open a conversation around their cannabis use, for example, the dose, frequency, when they're using it, just to get a better sense as to what risks or harms this person could be potentially putting themselves at. Great. That was a quick snapshot. My final slide today is an activity slide. So this is the case study. And what's going to happen is you're going to go into breakout groups, I'm sure, and Gemma will provide more instruction or support the class, and then discuss it amongst your teams, and just in a similar context as to the clinical snapshot. So what would be some important considerations and maybe some potential interventions. We recognize that this is an interdisciplinary group, so you can just speak to this case study as you would in an interdisciplinary meeting or amongst your teams. So you can also identify what roles you're in, and it's more about a conversation. There are no right or wrong answers. So the case study is a 60-year-old person presents to your rural health clinic with severe pain from osteoarthritis in their left hip. Their diagnosis has been confirmed by X-ray, and they have been referred to a specialist. They are also diagnosed with gastroesophageal reflux disease, or also known as GERD, and cannot take any non-steroidal anti-inflammatory medications due to GI side effects. So that's all your ibuprofen, that type of medication. This person also takes 85 milligrams of methadone for a past history of opioid use disorder and declines acetaminophen because they are concerned about liver damage. They also report consuming dry cannabis daily, and they would like you to speak to the prescriber about a prescription for cannabis.
Feel free to either unmute yourself or type it into the chat. What final questions do you have for Twinkle, Kate, or myself? And I'm going to remove that little balance word that's been there for a little while. Hi, Corinne. Yes, the presentation, I will be sending it out in the follow-up email as in a PDF format. So you will see all the slides and all the information that was posted on the slides. Vanessa, when is the next session? So the next session will be in December. Haven't finalized the exact date yet, but watch out for an email from myself, and it also will get posted on Facebook. If you follow the FNHA Facebook page, it will get added on there as well. Rose, I was under the impression this was for general public, so I'm not sure if my question would be even relevant. Well, Rose, you can go ahead and ask your question anyway, if you feel comfortable doing so. And this was available for the general public, however, with a focus for healthcare providers. But we wanted to make this available for everyone because there is useful information, learning, about cannabis and how the munchies come about. That was something I learned new. Twinkle, I know you did a fantastic job of answering the questions as they came through. Was there any that we had missing?
Hi, Gemma. Just like to add, I think Rose is referring to her question around photopsia. Interestingly, I will want to look into this, Rose, so I will definitely get back to you if you do share your email. Because this is not something I have looked at before around cannabis. Absolutely, yeah.
Yes, I did. Yeah. Right. Yes, and we said we would look into that question for you. Fantastic. Thank you, Rose. Oh, and thank you for your email. I was just about to say. Vanessa, we talked about pain the most. Is there a route that is more effective than others? I'm going to pass that over to Kate or Twinkle if they can help me out with that one.
Yeah, thanks, Vanessa. So the guidelines are for safer cannabis use. We suggest using edibles and oils for pain because you have that longer duration of action and you avoid the respiratory effects. I don't know if Twinkle has anything else to add.
Thanks, Kate. I think you covered it. Yeah, so the safer use guidelines definitely go back to using oral products as opposed to products that are being inhaled because of erratic dosing.
And I apologize, because I turned my computer volume down with the Jeopardy game. Twinkle, when I asked you if there were any other questions that I had missed, you were totally muted, so I didn't know if you answered or not.
I think I missed that too. Sorry, Gemma. I was reading Rose's message.
Okay.
I don't think there are other questions, but if there are, I'm happy to take them by email as well.
Yes, and in the follow-up email, in the slides that you'll see here, you will get all our email addresses on there, so you can send an email to myself or to Twinkle or to Kate. Okay, well, if there are no other questions, then I'm just going to quickly share that the first session that we did was back in October, and that was on why people start using substances and stigma. I will provide you with a link to this recording as well in the follow-up email, should you want to watch it, together with the recording of today's session on the effects of cannabis. Following up in December will be cannabis components and the methods of consumption. And then in the new year, we're going to be looking at cannabis across the lifespan. So from preconception to pregnancy to breastfeeding to the effects of cannabis in youth and so on. So watch out for emails from myself or on that Facebook page. And again, we do encourage everyone, even if you're not a healthcare provider, to join us, as there's always useful information that you can learn. So without further ado, then once again, thank you so much to Twinkle and to Kate for taking the time today to share all of your knowledge and wisdom on this topic of cannabis. And thank you each and every one of you for joining us and for taking the time and sticking right until the very end on this 90-minute session. Have a wonderful day, everyone, and enjoy. Thank you, everyone. Bye-bye.
Thank you.